Very well. Well, what I thought my goal was to show you what the context, what the rest of the environment is here in Indiana for the work of the center that you'll spend the rest of the morning talking about. Because as good as what you saw and will see has been, there's a lot more to centers like this when it comes to attracting sponsors, fellows, new faculty. And it's the environment of the departments, the school, the whole campus. And I'd like to comment on that with, I guess, sort of a pointing out how important a big philanthropic event has modified the trajectory of the entire school. And that, what I'm talking about, I know our dean, Craig Brader, has mentioned in the past. In 2000 or 2001, he called a bunch of us together into a room and he wrote up on the board, Times New Roman 12 point. We're going, what is he talking about? And you have seen him here, you know, he's a funny guy. And we've been approached by the Lilly Endowment. They said, we want to give you $100 million and now we need you to write a grant. And he was sort of lining up how many pages we'd have and how he wanted it to be typed up. Ultimately, the Lilly Endowment, which is money from the Lilly family, it's not the company, Eli Lilly, even though it invests largely in the company stock, donated ultimately $155 million expressly to build up our capacity to do research. They didn't really want to just give money for researchers or to buy, you know, centrifuges and supplies and stuff like that, but to bring in people and to create cores of expertise that lots of people could draw on. And they did, and that's been shepherded extremely well by Ora Peskovitz, who's our Executive Associate Dean for Research. This was about 7 or 8 years ago since that started, and what has happened since that time? Well, this has been probably one of the most enjoyable times to report to you because of some real record-setting stuff that's happened. Last year, the School of Medicine had, I think, a record year for research income of over $250 million. And the Department of Medicine, the department within the school that we belong to, also had a record by reaching over $100 million in research funding for a year. 1 year, it's a lot of money. Now we know that some of that was timing and this and that, and you can't look at 1 year at a time because stuff happens, you know, day by day and doesn't just start and stop in July. But it's really, we're doing as well as we ever have. And it's because we've got such great people that Keith's going to introduce to you. And we have to take advantage of people working in centeredness areas because they know the field, they're known by the field, and they'll take things forward. Well, there's been one other event that has that we've really finalized this year. Keith alluded to it in answering one of your questions. He used the funny acronym CTSI. A couple of years ago, the NIH, the main funding agency for medical research in the world, decided that it was taking too long to get the kind of discoveries that you're hearing about to patients who need it. And it was felt that it wasn't because people didn't want to do it or didn't feel that it was important, but that we needed new structures to do it, to streamline things and take away any impediments that might come from the difference between laboratory work with cells, laboratory work with animals, larger animals, human trials, communities. And so they decided to just completely overhaul the system by which they support this kind of work. And the CTSI means Clinical and Translational Sciences Institutes or awards. And you'll hear this word translation a lot. It does not mean languages, but the parallel is there. What it means is you have an idea, you see that a stem cell will work in an animal's limb, and rather than try the other limb and then see if it works in a pig and then work on a monkey, you go real fast to humans in a safe and effective way to get the information that you want. Because if it doesn't work there, it doesn't matter if it works in the other species, frankly, although you might find interesting things along the way. And so the NIH said, okay, here it is. These are big new things. You've got to show that you're very collaborative and you got to think outside the box. We applied 2 years ago on the very first round with not an expectation of being funded. And that may sound funny because it's a lot of work. But the idea was we need to get people talking together in the context of this grant. We need them to get their ideas out. We got to get our idea to the NIH and see how they trash it so we can address their concerns. And it was a much smarter approach to do it that way, although a lot of work, than it would be to simply work and work and work in isolation and then see what happens. I think we would have failed at that, you know, that first event in any event. So what is it? It is a grant of $25 million for 5 years to the entire state, I should emphasize. It's a partnership largely between Purdue and Indiana University, so it's known as the Indiana CTSI, not the Indiana University CTSI. Besides the $25 million in funding, there has been support from, in particular, IU, Purdue, and Lilly of another $56 million, which is often called matching funds or something along that line, as well as partnerships. I'm going to have to read this. I can't just list them off. Clarion Health Partners, which is our hospital organization. Crossroads, which is a statewide biotechnology sort of promoting company. Cook, Roche, WellPoint, the Indiana Economic Development Corporation, the State Department of Health, and the Marion County Health Department. And when I said it revamps how we approach things, it takes apart the little pieces and it puts them back together so that things move smoothly. And I'm going to list off and say very briefly what these components do, really as a shock and awe approach to see how broadly people had to think about this. And remember, it's not just Indianapolis, it's not just the School of Medicine. So there's a section on bioinformatics. We have one of the most robust computerized medical record systems in the entire world in central Indiana that links up our hospitals in a way that would let me in the emergency room find any applicable medical records of a patient that comes to the hospital comatose with no records. Medications, allergies, other problems, family history. There's almost no place that you can do that outside the VA. We have a community health enhancement program, which is specifically aimed at trying to use what we know and take it to entire communities. Best example is diabetes prevention. We know that if you can get people to adjust their diet and their exercise, and sometimes to use medications just because they have mildly elevated glucose levels, you can stop the onset of diabetes. Pretty amazing. It doesn't even take a stem cell. What it does take is a pair of track shoes and a smaller plate. Okay? We have an international health component because we have been in Kenya helping take care of patients with HIV for nearly 20 years. We're serving 70,000 people in Western Kenya, enrolling 2,000 more every month who have HIV, and we're helping get them on treatment that's funded by the World Health Organization and something called PEPFAR, the presidential funding for this. There is a very interesting project called Novel Translational Pathways, which says, you have a good idea, what is the very next thing you need to do? Don't be a professor of biochemistry. I can say this because I'm a professor of biochemistry, and think of all the cool things you could wander around studying for years. But what do you need to do in the next 3 months? We'll give you funding for it, and in 3 months we want to know the answer and we want to know where you want to go next. And it's a way of focusing people on the real shortest distance between an idea and either proving or disproving its value. And this is made to help people who haven't done it before. Frankly, Keith probably doesn't need this. He knows how to do it, but it's the environment for the younger people as well. There's pilot studies that are available to fund new things at a small level, that experimental risk that he talked about. A participant and clinical interactions resource to help us find patients for our trials. An education and training component, so if you will, a complementary training program to the training grants like this center already has funded. Biostatistics, something called modeling diseases. In some areas, we know enough that we can begin to say, well, you are 50 years old, here's your weight, here's your family history, here's your certain diseases. How should we treat you? And in sort of computer simulation, analyze, well, this medication with this genetic background is probably the best for you. That kind of thing called personalized medicine. Then we have some things that are just necessary to get it done properly. Regulatory support. I was thinking over here when Keith was talking about some of this, is, we use this term, this stuff isn't rocket science. That's right, this is a lot harder than rocket science. We were really good at rocket science in 1970, right? Because we went to the moon. And this is just hard stuff, and you have to do it very carefully because it involves patients. There's a bioethics core within the CTSI that looks at the big, tough questions. Who gets treatments? Who's excluded? What is consent? What is safety for patients? And then various things that are more traditional, like we have laboratories to store DNA, to do specific analyses, and so on. As you can tell, it gets me excited thinking about it because this is now the ground into which the next seeds will fall. And I hope to tell you even more exciting stuff 10 years from now when you're back in Indianapolis. Okay? I don't know if there'd be questions about that, but I'd be happy to try to answer them.